Okay, hello everyone and welcome today. Today's webinar is Getting Insulin Right from the Start. It's an introduction to the basics of insulin. My name's Alison Crowe. I'm a pharmacist and a Credentialled Diabetes Educator. So what you need to understand or have an awareness of when using insulin is what's covered in the webinar today. So the objectives are obviously overview for those new to insulin, and then to provide an introduction to the types of insulin, storage and delivery, and how to prepare your insulin pen device, hypoglycemia, sick day management, and a little bit about driving. So what is insulin? The pancreas produces a hormone called insulin so that the body can move glucose from the bloodstream into cells such as muscle cells. The glucose can be then used for energy within the cell. The glucose helps us to do things like power our muscles to move. In diabetes, the body either stops producing insulin or the body cannot produce enough insulin to keep blood glucose levels in target. Insulin by injection may be required to keep blood glucose levels in the target range. It's important to keep blood glucose levels in target to avoid long-term complications. So what we have here in the picture to the right is a stomach, and the stomach, you can see, is absorbing glucose in the form of those little white dots from the stomach, and those glucose molecules are being absorbed into the bloodstream. At the same time, you can see those green triangles on the picture. Those green triangles are representing insulin. So the insulin is being produced by the pancreas and is also absorbed into the bloodstream. So once you've got the insulin in the bloodstream, it is connecting to the glucose and it's helping the glucose move from the bloodstream into a cell, and in this case we have a muscle cell. So the types of insulin and injection regimes. So basal insulin is also known as background insulin. It's required to keep glucose levels stable during periods when we are not eating, such as overnight. It has a slow release of insulin over 24 hours. It is also known as long-acting insulin and can be injected once or twice daily. Bolus insulin is a short or rapid-acting insulin which is injected at the start of each meal to help the body process the glucose from the carbohydrate foods eaten. Short-acting insulin is often injected up to 3 times a day, just before or at the time of eating. A basal bolus routine of insulin injections may indicate that the person is injecting around 4 times per day of short and long-acting insulin. Mixed insulin, this contains 2 types of insulin in one injection. It has a shorter acting and an intermediate or long-acting insulin. As it has a short-acting component, it needs to be injected with a meal. Mixed insulin can be given once or twice daily, depending on the brand of mixed insulin. When you inject insulin, it's important to understand when you need to eat, how much carbohydrate to eat with each meal, and when you need to inject your prescribed insulin. Not knowing this can cause hypoglycemia. Hypoglycemia is when your blood glucose goes too low and is a medical emergency. Insulin products and devices. So insulin can be injected into the body in various ways. The most common way for insulin to be injected into the body is via an insulin pen. These insulin pens can be pre-filled with insulin and are disposable. Another way is having a permanent pen and load an insulin cartridge. That way the insulin cartridge is disposable, not the entire pen. If you have a permanent pen, it's important to use the brand of permanent pen that matches your insulin and to have a spare pen device at home. Half unit delivery is available in some pen-filled devices only. Insulin pumps are common among people with type 1 diabetes. Some people still use syringes and draw up insulin from a vial, but this is rare. So what we have are the pictures in the slide. The top picture is a picture of an insulin pen device. The picture to the left shows an insulin pump, and the picture to the right is a vial of insulin. So pen needle length and gauge. So to inject insulin from an insulin pen, you will need to place a new pen needle on the end of your insulin pen each time you go to inject insulin. The length of this needle is important because insulin is to be injected in the subcutaneous fat deposit just under the skin. If the needle length is too long, you may inject insulin into the muscle. This can cause rapid absorption into the bloodstream and cause hypoglycaemia. Pen needle length available ranges from between 4 millimeters and 8 millimeters length needles. The needle gauge refers to how thick the needle is. The higher the gauge, the finer the needle. Needle thickness affects flow rate and the force required to depress the plunger on the insulin pen. Needle gauge for insulin pen needles is between 29 gauge to 32 gauge needles, depending on the pen needle length and the brand. The preferred needle length to use to inject insulin is 4 millimeters. This includes for very young children and adults of all sizes. However, very thin adults and children may require a skin fold to ensure that the injection goes into the skin fat. Talk to your diabetes team about what size needle you need to use and how to inject. Ensure that you remove the pen needle from your insulin pen once you complete your injection. So how to prepare the insulin pen device. Firstly, you need to make sure that your hands are clean. You do need to inspect your insulin to make sure that there's no solids in your insulin. It's important to understand if your insulin is meant to be clear or cloudy. If it is cloudy, you need to know how to mix it, and you need to know how to prepare your insulin pen device for an air shot. So this video now is going to demonstrate how to prepare the insulin pen device.
Okay, so now what we're going to do is prepare our insulin pen device. First thing you need to do is wash your hands and make sure that they're clean. Then grab your insulin pen device and uncap it. Grab a new pen needle and screw it to the end of your insulin pen device. Then what I want you to do is just check your insulin to make sure that there's no solids. Insulin can be clear or cloudy. Refer to your manufacturer's instructions so you can understand if you have cloudy insulin, how you need to resuspend that insulin so that it is mixed evenly. General instructions for resuspending cloudy insulin is by rolling it gently a number of times or by tipping it from side to side gently. Do not shake your insulin pen vigorously because you can actually damage your insulin. Then what I want you to do is remove the outer cap, and you'll also notice that there's an inner cap that you need to remove as well. Now what we have is our pen needle and our insulin device. What I'm going to do now is just dial up 2 units. So I've done that by twisting the bottom. Now what we do now is to depress this bottom button, and what it will do is push the insulin via the plunger up through the pen needle. So if I just push that, depress that button there, what you can see now is droplets now coming through. That's called an air shot or priming, and what that's showing that our insulin pen device is working properly. It also helps remove any air bubbles as well.
Okay, so injection site and rotation. So when injecting insulin, the abdomen is the preferred site for injecting, as it's convenient and has reproducible results of insulin absorption. Other recommended sites that can be used include the buttocks and the thighs. When injecting around the abdomen, stay 1 centimetre away from the ribs, the lower belly, the belly button, and also away from other previous insulin injection sites. Dividing the abdomen area into quadrants and using 1 quadrant a week to rotate injections within that quadrant can help prevent lipohypertrophy. Lipohypertrophy is when injections are given into the same area and can cause thickened skin, causing hardening of the skin and scarred appearance. Avoiding injecting into areas that have scars, as it can affect the absorption. Older insulins can have different rates of absorption from different injection sites. So talk to your healthcare team about the injection sites you should use. If you did inject your insulin into a site affected by lipohypertrophy, how will it affect your blood glucose levels? The answer is the insulin will not be absorbed consistently or predictably. This may lead to blood glucose level issues. So in injection technique, it's important to be able to ensure the insulin is injected into the subcutaneous tissue, also known as the fat layer under the skin. The angle that a needle is injected is affected by the length of the needle and by how thin and how young a person is receiving the insulin injection. We generally use 4mm needles, and these are injected into the skin at 90 degrees. When injecting the insulin, it's important to continue to depress the plunger and hold the pen in place for 10 seconds. That way it allows the dialed up dose to be completely injected. Do not ever inject insulin through clothing. So this recording is going to demonstrate a practice insulin injection technique. So the following recording also follows on from the previous recording, where the priming of the insulin pen has already occurred.
Okay, so now what I'm going to do is practice injecting my insulin dose into skin. What I'm going to use here as a skin model is a sponge, and I'm not actually injecting into real skin. So what I do is I've got my pen device, and I'm just going to dial up 4 units, which is going to be the insulin dose. The way I hold my insulin device is by wrapping my fingers around and just having my thumb free to depress the button when I'm ready to inject the insulin. Now it's a 4mm needle here, and I'm injecting into adult skin, so that will be at 90 degrees. So I've got my skin model here, and when you go to inject your needle into the skin, don't push it really hard. You don't want it, the device actually depressing and making a dent in the skin. You just want to push that in gently like that, and then press your thumb down onto the device. Now what you want to do is hold your thumb there, and you want to hold that device in place for about 10 seconds. Then when you've counted your 10 seconds, I want you to keep holding your thumb on the device to pull out your pen needle. what that will do is to ensure that the insulin that you've dialed up, your dose, has been fully delivered and completely injected into the skin. Then what I want you to do is, once you've removed it, is to get your outer cap and place on top of your pen needle. That's what you use to unscrew your pen needle from your pen device. Then I want you to put your pen needle and dispose of it into a sharps container, and then grab your cap and put it back on your insulin pen.
So just recapping there, that the needle is a 4 ml needle, and in healthy adults it's injected at 90 degrees. Very young children and very thin adults may need a skin fold. So talk to your diabetes team about your injection technique. So sharps disposal. It is important, once you have injected insulin, to remove the needle from the insulin pen and dispose of the needle in a sharps container. Firstly, removing the pen needle after injection prevents air or other debris to contaminate the insulin cartridge or prevent insulin leakage from the pen. Proper disposal of sharps prevents sharps injuries to others from contaminated needles. The picture to the right is an approved hard-walled sharps container. These containers are available to purchase at pharmacies, some needle exchange centres, or contact your local council. Disposal of containers may occur at hospitals, participating pharmacies, or contact your local council for instructions on how to dispose of full containers in your area. The link on the bottom of the slide that labels Safe Sharps, that's a website that has a map of sharps disposals in Australia. You can also download the app to help the developers keep the website information up to date. So in insulin storage, insulin is kept in the fridge when it is being stored. The insulin pen that you are using comes out of the fridge and stays out of the fridge. When you begin using the insulin pen, note the date. The insulin pen needs to be thrown out after 28 days. Check with your manufacturer the exact number of days. Even if the pen still has insulin in it, throw it out, as the insulin will begin to degrade. It will not be as effective. Keep your insulin pens out of the sun and away from heat. This can degrade the insulin and it may not work as properly as it should. So do not store insulin in your car. Once you bring your insulin out of the fridge, placing it back in the fridge does not prolong its life. You need to throw it out after the 28 days. So I've got a question here. So what do you think will happen to your blood glucose levels if your insulin has not been stored as per manufacturer's advice? Apart from the insulin should not be injected if it has not been stored as per manufacturer's instructions, the blood glucose will respond and be unpredictable, such that the insulin may not be effective at lowering blood glucose levels. Some other points are that you should not use insulin that has been frozen, and if you live in a very cold or a very hot environment, you might need to consider a pen wallet to protect your insulin from temperature extremes. So hypoglycemia, as a result of injecting insulin, one of the issues is that you can experience hypoglycemia. Hypoglycemia is when your blood glucose level is less than 4 millimoles per litre. When you are injecting insulin, a low blood glucose can be the result of injecting too much insulin or not having enough carbohydrates spread over the course of the day. Symptoms include shaking, trembling, mood changes, being lightheaded, paleness, sweating, and people may also lose consciousness. Treatment of hypoglycemia is 15 grams of fast-acting carbohydrate. Food that is fast-acting carbohydrate includes 6 to 7 jelly beans, half a can of regular soft drink, not diet soft drink, half a glass of orange juice. You should carry hypo treatment with you. After 10 to 15 minutes, recheck your blood glucose levels to make sure it has risen above 4 millimoles per litre. You may need to repeat the steps above until your blood glucose levels are above 4 millimoles per litre. You may also need to follow up with some longer acting carbohydrate. Talk to your healthcare team how you should manage a hypo. Physical activity can either reduce or increase your blood glucose levels depending on the type and intensity of exercise. So always check your blood glucose levels before exercising. So with physical activity, it's an important part of staying healthy and managing your diabetes. Physical activity can help manage your blood glucose levels by using up glucose and bringing down your blood glucose levels. Various forms of physical activity, such as strenuous exercise, can actually increase your blood glucose levels. It's important that you understand how physical activity affects your body. If you are on insulin or a glucose-lowering medication, it's important to know that exercise can cause your blood glucose levels to drop low. Physical activity can affect your blood glucose levels for up to 48 hours after exercise. Check your blood glucose levels before and after exercise. You may need to check your blood glucose level during exercise if it lasts for more than 30 minutes. Stay well hydrated during physical activity and wear appropriate footwear. An exercise physiologist is a person that is qualified to analyse and prescribe exercise for you and your body whilst understanding your medical and your physical conditions. So talk to your doctor and your healthcare team about how to access an exercise physiologist in your area. So sick day management, it's important to understand how to manage your diabetes when you have an illness, and you should not ignore the fact that diabetes is affected by illness. So talk to your healthcare team about a sick day management plan. The sick day management plan will outline what you need to do in order to manage your blood glucose levels when you're sick. You need to understand when you need to action your sick day management plan. You also need equipment available to put into place and action your sick day management plans. So some of the equipment might be ketone testers, hypoglycemia treatment kit, a reliable blood glucose monitor, and also having a support person that knows that you're sick and that you've got your sick day management plan, action plan in place. You also need to know when to seek emergency medical attention. So once you begin using insulin or other glucose-lowering medications to treat your diabetes, if you hold a driver's license, you will need to notify the driver's licensing authority in your state. You will need to undergo a 2-yearly review by your treating doctor, endocrinologist, or diabetes specialist. This review will produce a medical certificate that you are required to carry as part of your normal license and produce it when requested by police. Your doctor may also advise on the medical certificate what your blood glucose level must stay above in order to drive safely. You are required to check your blood glucose levels every 2 hours before you begin to drive and while you are driving. If you are in an accident while you are driving, you will need to show proof that you have checked your blood glucose levels before you started driving or 2 hours while you are driving. carrying carbohydrates to treat hypoglycemia, stop and check your blood glucose levels if you feel unwell. If you have a blood glucose level less than 4 millimoles per litre or hyposymptoms, do not resume driving until your hyposymptoms have completely gone and your blood glucose level has remained above 5 millimoles per litre for at least 30 minutes. So the National Diabetes Services Scheme registration is free to those who are diagnosed with diabetes in Australia and who hold a Medicare card. The NDSS provides access to subsidised items such as pen needles, monitoring strips, or continuous and flash glucose monitoring products, and insulin pump supplies for those who have type 1 diabetes. If you have type 2 diabetes and are newly starting on insulin, make sure that your healthcare team updates your membership to advise the NDSS that you are now using insulin, as your entitlements through the NDSS will change. The NDSS provides a range of evidence-based fact sheets on our website, and we have a range of online and face-to-face programs as well. The NDSS helpline service is available to get support on advice on diabetes self-management, talking to a health professional about managing your diabetes, learning about NDSS products, requesting a replacement registration card, or updating your contact details. So we run a program through the NDSS called Living with Insulin. It's a 3-hour group workshop. It's no cost for people registered with the NDSS. It is suitable if you are new to insulin or have been on insulin for a while and would like a refresher. It covers how insulin works, injection techniques, products and supplies, blood glucose monitoring, and hypo and hyperglycemia. So if you do have any questions today, I just want you to know that you can actually call the NDSS helpline on 1800 637 700 if you do have any further questions or you'd like to speak to a health professional. I also want to thank you for joining us today. And as I said, if you have any further questions, contact our helpline. And thanks for joining.